So, first off is John Johnson, and he's presenting on the effect on social regression in elementary age children during the COVID-19 quarantine period.
Awesome. Okay. So the effect of quarantining elementary age children during the pandemic and the psychosocial indicators of social regression. So the goal is to do a systematic review. It's not complete yet, but I'm just going to be presenting some preliminary findings here. No conflicts of interest. So let's start off just by looking at the current state of the matter. Quarantine measures in elementary age children. So with 21 million deaths globally, the COVID-19 pandemic continues to be one of the most notorious crises in history. And quarantine measures were placed to prevent the community spread and individual risk associated with that. Now, while seemingly this elementary age category right here has the least number of community spread and individual risk incidents, these children are actually the most likely to partake in mandatory school education and therefore are at a higher risk of contributing to increased incidences. The school closures right now, especially, are a hotly debated topic for how COVID-19 is affecting young children. So people like Chloe here are no exception for that. According to UNESCO, the education of nearly 1.6 billion people all around the world in 190 countries have so far been affected. And that's 90% of the world's school-age children. What moves to in Canada to actually open schools, it becomes one of the even more greater concerns. Several families in quarantine have been particularly concerned about the feasibility and effectiveness of learning from home, where their children must actually learn differently. So what we did was we embarked on this review to assess what these remote education models can be like and how it can impact children like Chloe here and their psychosocial development and how it may affect social regression in these kids. So a little bit of background about what social regression really is. So we look at these sensitive periods of brain development, which is basically the way that you learn over time. And you can see certain areas of the brain that I've sort of highlighted here. And what you can see is that these learning curves essentially are peaking around this age when the children are in elementary. So what you can see is the brain development actually peaks around age 8, 9-ish. And over time, it's quite important. This whole plateau here that goes down is actually quite important in maintaining that development. So you can see things like the sensory-motor cortex, which is important for sensation and motor function, the parietal and temporal association cortex, which is quite important for for emotional regulation, and the prefrontal cortex, which is important for decision making. The main objective of our study here is to evaluate the effects of home confinement, remote education models, and related quarantine factors that can have repercussions on this child's ability to learn, acquire, and navigate society. Our methods for this was a systematic review. We identified 39 papers using standard databases like PubMed and Google Scholar to collect and synthesize evidence. And some of the parameters that we included were, we only included children aged 6 to 15, and from quarantine onset, which was, in this case, March 11th, all the way to July 31st, which was at the time present. Some of the keywords that we used included quarantine, mental health, or psychological, and children. So as you can see, we have methods here. We followed Prisma guidelines for the most part, and we tried to get 2 people, so me and my brother, to look through and complete the identification and screening for eligibility. And we would ideally, for proper signs, use a third person to resolve any dispute of identification, but that has not yet been done. So here are the results. So we have a little bit about the qualitative factor analysis that was being used and is used to identify a multitude of observed variables within the factors. So you can see all the observed factors are those outside these hexagonal shapes, and those inside are the factors associated with it. And basically what factor analysis is doing is looking at what's inside and what's outside and looking at the relative associations between the two. And essentially what we've got here is the variables in green, which are associations, and the variables in red, which are actually suggested. And what we found were not actually associations. So we'll start at the top here. So I think one of the most common misconceptions is that the school closures and online education actually increased social withdrawal and screen addiction. We found that was not necessarily the case. People weren't actually suffering from screen addiction any more than they already had, and they didn't show significant signs of social withdrawal either. We also looked at how the school closures affected the development of learning, and particularly looking at language learning. And what you can see here is actually the critical period of language and how people retain new language development over time. And one of the things that we found out was one of the compromises for a lot of remote education for children is language development because online learning interactivity and immersion become compromised. So interpersonal elements that are quite essential for language development are missing. So that being said, it really builds the case for conferencing tech such as Zoom and Discord here to build in additional breakout room type capacities that can really help facilitate those types of discussions and retain language to a large part. Next one here we have acute social isolation. So one of the suggested correlations were quarantine boredom, and that's also a myth. It seems that people don't actually suffer too much from boredom. It seems that people can get by for the most part, and these are all general associations, by the way. So not to generalize anything too much. It seems that quarantine boredom is not a significant part of the acute social isolation. It seems that people are mostly living with social connections and feeling socially fulfilled in ways that are similar to before the pandemic. Another association, which was shown to be correct, was that it can actually increase loneliness and annoyance living in social isolation. So next we have the rising COVID-19 incidents and media attention, and particularly what this has been associated with is a lot of worry, anxiety, and mild stress. Now, the thing that people were not quite sure of was the PTSD and whether having this much attention in COVID-19 can actually increase signs of post-traumatic stress disorder. And what we found was that it actually did show a correlation. So here, this is a graph that's just showing PTSD as a general correlate with different countries. And you can see quite easily, evidently, like the countries that have more COVID-19 are associated with a higher prevalence of PTSD. So the places like the US and France are really high. And you can see that there is quite an apparent correlation there. While this hasn't been done in children in particular, we assume that because this is a big risk factor for adults, it's quite likely in children as well, especially as they're growing up. So now looking into particularly the indicators of social regression. So these are some of the things that we identified from our study that we felt could really contribute to social regression. So this includes worry, helplessness, fear, nervousness, anger, annoyance, loneliness, isolation, insomnia, and thoughts about COVID-19. And all of these were different things that we found were significant over time. And some of these characteristics in particular were associated with social regression. And the total cohort was 3,940 students. And once we completed the statistical and factor analysis, we were able to find out that these three in particular, insecurity, fear, and anger, were most associated with social regression. And these preliminary results suggest that the pandemic has actually really created a heightened state of panic that can really facilitate this. So on to now some of the limitations of our study. So we used a relatively small sample size. You obviously can't get the full picture with these the level of samples that we did. So we had 3,940 students from the 39 different studies we looked at. And then also these things are still preliminary and difficult to objectively quantify using survey-based data, especially also keeping in mind that these data is from elementary age children. So you might have people like Joey here who like to go in and mischievously fill out a survey and maybe just do it for fun. And what you'll see is that these results aren't actually accurate. Uh, these are also challenging to ascertain more chronic results. So particularly looking at things like PTSD, which takes quite a bit of time to acquire. And it also is hard because social regression really represents some multi-factor and multifaceted phenomena, and it remains quite hard to conduct robust factor analysis. So, all in all, those are some of the limitations of the study, and I'll just briefly summarize the main findings, as well as what we think will happen for most of these findings. So, the psychological and physiological effects of quarantine on children aged 6 to 15 is quite higher in comparison to non-quarantined peers in mild stress, anxiety, and increased likelihood of developing PTSD. We also found that indicators of social regression are increased during the pandemic and result in improper brain development in these children. And thirdly, we found that remote education doesn't appear to play a significant role in directly facilitating or curbing these effects. So, all in all, I'd just like to thank everybody in the Antarctic Institute of Canada for facilitating this, particularly Peter for doing some of the systematic reviews things with me, and Austin Martin for being the primary principal investigator in all of what we do, and just the funding agency of Canada Summer Jobs for paying me. Thank you.
Thank you so much, John. That was super comprehensive. So now we're going to move on to the Q&A section. So the first question is for John, and Zach is asking, Italy was a hotspot for the pandemic early on. Why do you think their numbers for PTSD prevalence remain low?
Okay, so I think that a few of these countries in particular, they have different types of educational systems and educational effects than some of the others. So these were the results, just to refresh. So you see places like Italy, which was a hotspot. I would assume like most of these results are like spontaneous, and I basically looked at it in terms of quantitative associations, and what we saw was like most of these were generally appearing to correlate with one another. If I had to speculate, there must be like some regional effects associated with the pandemic fear and policies and how that affects one another and behaviors. And I think it's just very convoluted right now. So I think that's like the main reason why it's not clear cut in terms of associations.
Thank you, John. Another question. So for John, Jess is asking, what can parents do to protect their children from developing stress, anxiety, and PTSD when in these quarantine and new learning situations?
So I think that one of the major ways that you can really help prevent the fear response in children is just to offer them with proper time and care. I think like having conversations about this with your kids is quite important. I believe that it's quite important that you show empathy and you show that it's quite important that if you have children who are maybe a little bit more, who are responding a little bit more emotionally, that we offer strong supports as parents and that you are basically giving them opportunities to really connect with one another. I think that the biggest resource and um, benefit that we have like against COVID-19 is the fact that we can all rely on strong social support networks. So if your kids have, say, friends from your school, like being able to call them and really being able to make sure that they still get those types of social connections. I think that would be like the biggest way to sort of fight some of the I guess negative fear and paranoia and loneliness and all of that that the pandemic has caused.
Awesome. I actually really like that answer. Thank you.